Hello, in this session we are going to be discussing about independence in activities of daily living or ADL for young children with autism. First of all, let's look at what is ADL. So ADL or activities of daily living are fundamental tasks related to self-care that allow an individual to look after themselves in their given environment. These skills typically include a range of activities such as dressing, eating, grooming, bathing, toileting, etc. Encouraging and developing these skills are important for daily living and to create opportunities for children to grow and live as independently as possible. These skills, once learned, may become established routines that children with autism to perform independently. Now, let's look at why is it so important to address independence in ADL at the earliest as possible for children with autism. First of all, it gives them a sense of accomplishment which is linked with adaptive behavior, especially for children with sensory modulation issues associated with autism. Secondly, it is associated with positive transactions and independence of individuals with autism into the adulthood. In addition to that, reduction in parental stress when children with autism are taught daily living activities. Most parents of children with autism tend to consistently jump in and help the child to do their self-care routines in the earliest stages and later on find it difficult for both parent and child. Remember, teaching these skills to the child is very important because children with autism may not learn these skills by imitating you or just by seeing you do it. Now, let's look at what are the challenges in ADL among children with autism and how to identify them. Because self-care routines are patterned behavior, children with autism often learn and perform many skills independently. But still, it is difficult for parents of children with autism to teach these skills. This is because of a few reasons. Firstly, sensory modulation issues associated with autism. Most often, autism is associated with sensory processing disorder, which makes them learning these skills and tolerating the sensory experiences really challenging. The sensory information that children with autism receive from their body and from the environment while doing self-care activities may be processed inefficiently. That is, some may be very sensitive or some may seek more input. For example, feeding requires tolerating the textures of the food, different tastes of the food, the oromotor experience while chewing, tolerating the temperature of the food item, etc. And dressing requires toleration of fabric textures, the edges of sleeves rubbing on skin, the feel of elastic waistbands, etc. Remember, clothing sensitivities are different from a child having preferences. Bathing requires toleration of water temperature, the tactile experiences of soap over skin, the smell of soap, and the feel of the towel or washcloth. In addition, washing someone's hair may require leaning backwards with eyes closed, a scary motion for someone with vestibular difficulties. Toileting requires the experience of wiping with toilet tissue, perhaps the feeling of water spray, smell of the toilet, and the noise of the flushing water. Secondly, motor and praxis difficulties. Performing self-care activities also require motor and praxis skills to complete the task successfully. So for some children, the difficulties can be due to inadequate fine motor skills, poor coordination, balance issues, and praxis issues. These skills are necessary for buttoning, fastening zippers, open the cap of the toothpaste, holding the brush with proper grip, tying shoelace, mixing food, holding a spoon and scooping, etc. Remember, it is very important to identify whether it is a sensory modulation issue or difficulty with the motor skills. Another challenge would be due to communication problems. Learning self-care involves following verbal directions, which could be difficult for children with autism. Also, difficulties with receptive and expressive language may take it difficult to understand and convey their needs in terms of self-care. Fear of change in environment. Children with autism resist having a change in their regular environment and change in routine structure to do self-care activities, as it causes high level of anxiety in them. Sometimes it could be even a change in the layout of the arrangements in the room or presence of a new people or things or absence of familiar ones. And sometimes it is just a change in order or steps of an activity. Motivation. Children with autism may not be motivated by the social feedback. Having well groomed according to the socially accepted ways may not be self-motivating for them. It is very important to know the child with autism and their preferences and tolerance level before teaching these activities. Strategies to improve independence in ADL for children with autism. Let's look at some strategies to improve independence in ADL for children with autism. Firstly, task analysis or analysis simply means to break down the steps of a task into chains of simple, smaller steps. Children with autism finds it easier to learn skills step by step and in chained patterns. Also, it makes it easier for parents to know how to teach and know the progress of a task. Let me give you an example. Washing hands is a task. We can break down this task into smaller steps such as reaching the sink, opening the tap, run the water over the hands thoroughly, turn off the tap, apply soap or hand wash liquid, scrub the hands for 5 to 10 seconds, turn the water back on, rinse the soap off the hands thoroughly, turn off the tap and dry the hands. We could try focusing on completing one step of a task at a time, and as you gain some momentum, then you can go to the next level. Remember, sometimes the child takes longer time than you expected, but it's okay. Every single effort is worth it. Another strategy would be using visual schedules. A visual schedule is a sequence of photographs, line drawings or symbols, text or any other visual format that is used to show a child what she or he is expected to do. Many children with autism have stronger visual processing skills than auditory processing. So having a visual guide that has each step of a task helps them to reduce the cognitive load, thus making the task easier. If possible, having this visual schedule placed in the appropriate environment where they perform the task is even better. You can also consider personalizing the visual schedule by using images of your child completing the steps of each activity. Creating a routine. Not knowing how long a task will last can be very stressful for children with autism, especially the ones with sensory modulation issues. So creating a self-care routine for a day, showing what comes after what, and a time slot will help them to anticipate and plan the task. Also, it reduces the cognitive demand and it eventually becomes habituated. Consistency in practicing the task daily is required to make a progress. Structured environment. Having a well-organized environment is needed initially to teach an activity. Once a child learns it, we can make it to a semi-structured or unstructured environment so that the child will be able to generalize the skills. Social stories. Social stories are simple storylines with clear pictures which is used to help children with autism develop appropriate behavior and responses to challenging situations. Social stories can be helpful for a child with autism to provide more opportunities to read and talk about a particular task and to explain what is expected of a child. It gives them an idea of the whole task and help them to prepare and thereby reducing stress. Social stories also provide opportunities for a child to communicate if they need any adaptation of a task. Reinforcement. Rewarding the child will provide them with feedback on what they did well and will encourage them to be successful with the step next time. It also ensures the skill you're focusing on is a positive experience for your child. This reward can be anything that the child likes, but we should make sure that we are not giving too much of it. Also, we should make sure that we provide the reward immediately after the step or task is finished, and it should be specific. Example, I like how you put the toothpaste on your toothbrush. Backward chaining and fading prompt. Backward chaining comes in handy when multi-step tasks are too difficult to master all at once. Teaching the child the last step of a task first will help them to develop a sense of accomplishment, and it helps them motivated to repeat the steps. For example, to put on a t-shirt, initially you can help them to wear until putting the sleeves, and now ask the child to pull down the t-shirt independently and reward for it. Fading prompts. Also, we may provide physical support such as hand-over-hand guidance, modeling, pointing prompt, or verbal prompt to teach skills. But as a child improves with his or her independent skills, be mindful to reduce the prompt over time. That is, initially we can give physical as well as verbal prompt to teach a skill, then slowly reduce and remove the physical prompt as the child learns it. Then work with only verbal prompt, and once they are consistent with that, slowly reduce and remove the verbal prompt too. Things to remember. Set goals that are realistic and according to your child's ability. Plan the goal with your child and adapt the environment if necessary. Be consistent and patient with the child. Routine and consistency are the key to building a learning environment for your child where they feel safe and motivated to take the necessary risk of learning. In another session, we'll be looking at each areas of ADL in specific and some general strategies and adaptation to improve independence. Thank you.